Hi, welcome to our YouTube channel. This is MAP, Migration to Asia Peace. Asylum seekers in Korea go through difficulties every day due to language barrier and lack of information. MAP's Peaceboard project aims to support asylum seekers to overcome such difficulties and get on with everyday life in safety, covering 10 crucial topics to know, such as application for refugee status, immigration office, health, education, and labor. This series has subtitles in English, Arabic, French, and Russian. Disclaimer: the content is not legal advice. If you have any questions, please contact MAP. Health thoroughly interferes with various aspects of life, gravely influencing the general quality of one's daily life. Balancing between adapting to the new environments in Korea and applying for refugee status determination procedure can expose you to physical, mental, and psychological stress. This could easily put anyone's health at risk, let alone those that were originally suffering from chronic illnesses. In such instances, it is crucial to receive effective medical support as soon as possible. To protect your rights to timely health care treatment and help your understanding on the Korean medical system as a whole, the upcoming 2 episodes will be dedicated to healthcare guidelines for all asylum seekers. Under Article 42 of the Refugee Act, relevant presidential decrees obligate the Ministry of Justice to provide the following medical support for refugees. First, if deemed necessary to protect the health of an asylum seeker, pursuant to Article 42 of the Act, the Minister of Justice may have the asylum seeker undergo medical examinations or subsidize the medical examination costs, etc., of the asylum seeker within budgetary limits. Second, the Minister of Justice shall endeavor to provide asylum seekers with information on emergency medical service prescribed in the Emergency Medical Service Act and information on other medical services available as the asylum seeker. Third, the head of a relevant ministry or agency who intends to provide medical services as to an asylum seeker may request the head of a regional immigration office, the head of the sub-region office, or the head of the branch office to verify the identification of the asylum seeker. In such cases, the head of the regional immigration office, the head of the sub-regional office, or the head of the branch office shall verify if the person is an asylum seeker and inform the ministry or agency requesting such verification of the results, therefore, without delay. However, the above stated form of medical support is highly insufficient for those asylum seekers that suffer from chronic or acute illnesses, which may require examinations, surgical procedures, outpatient treatment, or medication. Most fundamentally, asylum seekers can enroll under National Health Insurance as local subscriber. Further, the making of any form of economic profit is prohibited for the first 6 months since refugee status application, which immediately disqualify all applicants from enrolling under employee health insurance as well. Even after the 6 months, the vast majority of asylum seekers which work as temporal or daily employees still remain unprotected. Under such conditions, it is crucial for asylum seekers to be fully informed of the health care system in order for the protection of their rights to health. MAP is honored to introduce some of the necessary information you may need to access basic medical support. The holistic process from refugee status application to application closure can be divided into 3 different phases. Today's episode will focus on the first phase, sharing healthcare information that you may find helpful if you have just applied for refugee status. Here are the 4 healthcare tips for any and all new asylum seekers. First is on the Korean healthcare delivery system. Have any of you ever experienced visiting a tertiary hospital for trivial symptoms and ended up paying an expensive price for minimal treatments? In order to prevent such situations, it is important to understand the Korean system of healthcare delivery. Korean medical institutions are largely divided into two private institutions, the public institution. Private institutions are then classified into three different levels, where each can provide primary, secondary, and tertiary care. Primary care is serviced by clinic level medical institutions, including a local medical clinic, dental clinic, oriental medical clinic, and community health care center. Many of these institutions are local, with average number of 30 all underbeds, providing services primarily to outpatients. Secondary care can be provided by a hospital, dental hospital, oriental medical hospital, convalescent hospital, and a mental hospital, which provides 30 and more beds. Also, a general hospital with 100 or more beds is a secondary health care institution. In comparison to primary care institutions, a wider variety of examinations and a more specialized treatment is available in secondary care institutions. There are normally located in each ward or city, and a secondary care institution with 300 or all under beds are obligated to provide services in a minimum of 7 medical specialties, and those with over 300 are a minimum of 9. Last is tertiary care, which is provided by tertiary general hospitals. Every 3 years, the Ministry of Health and Welfare designates those general hospitals that provide highly specialized medical services for treating serious diseases as tertiary hospitals. In each institution is stationed 500 or more beds, and they service for both outpatients and inpatients. The institutions have at least one specialist in each of the 20 or more medical treatments and are located in almost all cities. One thing to consider is visiting a tertiary healthcare institution is that all patients are required to submit a medical referral written by a primary or a secondary institution. Otherwise, your treatment may not be covered by a national health insurance, resulting in extensive bills. Once all conditions are met, the Korean National Health Insurance will cover your treatments from all 3 levels of healthcare institutions with a certain disease. The insurance takes up to 70% of the original fee. Please keep in mind that the extent to which the National Health Insurance can cover your expenses may vary depending on the institutions and treatment. Next is a list of tips for those of you that seek ways to receive medical treatment at a lower cost. First of all, any trivial symptoms or casual sicknesses, a cold for instance, it is wiser to visit a primary care institution where the expenses are minimal. For any of those situations that require more than one visit to the clinic, visiting the same clinic over moving around several of them saves money. This is because the initial consultation and treatment is normally pricier than revisits. Second, the expenses can also vary depending on your date and time of visit. Any visits during the night time and all public holidays will result in a 30% additional fee, and for the case of emergency care, the emergency operation, a 50% additional fee. If possible, it is best to visit any healthcare institution in between 9 a.m. to 6 p.m. during weekends and 9 a.m. to 1 p.m. on Saturdays to save budget. Lastly, please keep in mind that any stay past midnight will lead to the additional of 1 day in calculating the duration of hospitalization. Hospitalization between 12 a.m. and 6 a.m. and discharge between 6 p.m. to 12 a.m. will also lead to a 50% additional to your payment. Last of the tips on managing the healthcare budgets is utilizing the healthcare assistance for foreign workers. by Ministry of Health and Welfare. The assistance policy protects the social minorities that are not covered by the National Health Insurance and medical benefit. All asylum seekers, regardless of the latest date of immigration, can receive monetary support through the system above if illness is first found within Korea. Those cases include hospitalization and operation, but outpatient treatments in general are not covered. The exceptions of prenatal care and outpatient treatment for those underage children of asylum seekers, however, are still covered by the policy. Those outpatients visiting pre- and post-hospitalization or operation and are permitted for ex-post settlement with the limit of 3 visits respectively. The above policy supports up to 90% of the final fee at a maximum of 5 million Korean won. On screening is the list of institutions that have enrolled to the policy as of 2023. Please refer to the relevant department, often the social support department of each applying institution, for further information on the healthcare assistance policy. In cases of further inquiry, please contact MAP. As you have seen earlier, a wide variety of institutions ranging from primary and tertiary level have signed up for the assistance policy. Out of the 89 institutions that have enlisted across the country, 12 are stationed in Seoul, 8 in Incheon, and 16 in Gyeonggi province. 2 of the rest are in Daejeon, 2 in Jeju, 1 each in Daegu and Ulsan. In Gwangju, there are 3, Cheonggu-cheongnam-do, 4, and other 2 in Cheongcheongbuk-do. In Chola-uk province, you can find 7 on the list and 5 in Chola-nam-do. Lastly, in Cheongsangbuk-do and Cheongsangnam-do are located 5 and each respectively. The last piece of information we would like to share today is on the free clinics. In each major city are located a number of free clinics. In Seoul, there are 4 free clinics available: Dale Angel Hospital in Dongdaemun-gu, Songdong Global Migrant Center in Songdong-gu, Seoul Medical Association in Yeongchung-do-gu, and Korean Open Doctor Society in Junggu are those. Please make sure to bring with you your passport or foreign registration card in visiting any of these institutions. Further, in Busan are located 2 free solidarity with migrants and green doctors. In Jingu are the 2. The institutions do not require a passport or an identity card. Next is Gwangju, Ulsan, Daejeon, Gwangju Migrant Health Center, Ulsan Migrant Center, and Daejeon Migrants Welfare Center are located in each city. The first 2 of the Gwangju and Ulsan do not require your passport or ID. However, Daejeon Migrants Welfare Center does require such identification documents. Next up is Cheonggi-do. In Pyeongtaek are located Anjung Public Health Center and Songtan Public Health Center, and in Buchon is Buchon Migrant Workers Center. All three do not require your passport or identity card. In Gwangju of Cheonggi-do is located Gwangju Support Center for Foreign Workers, and Gimpo is maintaining Gimpo City Foreign Resident Support Center. Both require the identification through either passport or ID. Padalgu Public Health Center and Wongguk Public Health Center are each located in Suwon and Ansan of Cheonggi Province. Both require identification, so please make sure to take either your passport or identity card with you. Wongguk Public Health Center's services on both weekends and holidays, and further provides a variety of healthcare support for immigrants, so please check out further details on their official website or other landlines. Lastly, there are 2 free clinics stationed in Cheongsang-do. In Cheongsang-buk-do, there is Cheongsang Migrants Rebara Center located in Cheongsang, whereas in Cheongsang-nam-do is Cheongsang-nam Immigrant Center in Changwon. Please refer to the information for the business hours and available medical departments, and contact each applying institutions for clarification. Also, please double check to see whether all, not the free clinic in your region, requires any form of identification. Today's episode was a brief introduction of 4 different tips and facts that might help new asylum seekers. The upcoming 7th episode will focus on tips for those past 90 days and 6 months since refugee status application respectively. Please contact MAP for any inquiries on episode 6. Thank you for your time and attention.